souls honoring Elohim's mandate. And now for today's message.
Well, hello. Welcome to SHEM Ministries. That is Souls Honoring Elohim's Mandate. And I am one of the lead servants. This is our SHEM 2 night. SHEM 2 is a spiritual, healthy, enlightening mandate ministry. We thank God for how He has birthed SHEM 2 out of SHEM Ministries. It was a union between Ask Anna and SHEM. They married and became one. But SHEM 2, to differentiate between the medical ministry, is the choice of SHEM 2 with the acronym that I had just given you and what those letters stood for. So we have been blessed to broadcast this ministry live for almost 4 years. Yes. Wow. Has it been that long? Yes. To God be the glory. God ain't messing. He's blessing. And I do want to take a moment for those who have been affected by the Hurricane Helene. Surprisingly caused a significant amount of damage that was totally unexpected. And what I have to say about that, all things work together for the good, and I am so sorry that those who have encountered such loss of their homes, loss of their town, their community, have gained, believe it or not, the love and kindness of neighbors, strangers, people they never even knew lived up the road from them. Can it be a lesson? Can it be God saying to us, you can't predict me. Don't take my loving kindness for granted. The life, health, and strength that you get every day, the mercies that you get every day, don't take them for granted. I am so sorry for all that they have gone through, but my message to those who are still living in the land of the living, those who may not be encountering the situation that many of them are going through, and I'm speaking of North Carolina, South Carolina, Georgia, Florida, and let's even go back to the previous hurricane that touched in the Southwest, Louisiana, down that area. We knew hurricane season was coming. We know that. So thank God we had a warning. But we can't take God for granted and predict the category 3, category 4. We can't predict the strength of the storm. And if this shakes up the world, Stop trying to predict me. That's all I can say is I pray that the good comes from it, that people are able to restore what they have lost, that they would gain more than what they lost, and in the process, renew their strength, rededicate their lives to God Almighty, who is in control. Pastor Devlin was praying and speaking on these things last night, and I tried to remind everyone about Nahum 1:3, where the Bible lets us know that his feet, God, his feet are the dust of the clouds. He steps where he wants to step. When you step, you can step light, you can step hard. You can drag your feet, you can tap your feet, you can run through so fast, or you can take your time and crawl, not even using your feet. God is in control. But we do thank God for that moment of reflection and recollection of what has transpired, and pray for those people, individuals. Now, Heavenly Father, we give you all the honor, the glory, and the thanks and the praise for this night, this evening's message. And I ask, Lord, that you bless it to be a blessing to your people. And on last week, let me go back and introduce myself to those who may not know me. I am Dr. Anna Shaw Devlin. I am a family nurse practitioner, and I love what I do. I do. I inhale God, and I exhale God, and I ask the Lord to allow my flesh to die and be crucified so that he can speak through me to you. And on last week, we talked about menopause. Pause. We talked about a period in menstrual period, a period in a woman's life where she advances in age, and the ovaries that produce estrogen dwindle and decrease in the amount of estrogen produced, causing a period of menopause. And we talked about the menopause itself is a 12-month period of time in which a woman no longer menstruates. And I'm not going to go back and redo that lesson, because I would love for you to go back and review it if you had not already. But this is part 2, and we're going to move forward and kind of drill a few things and add a couple of things to that lecture that I want you to know. I do want to go back and talk a little bit more in depth about osteoporosis, because believe it or not, the hot flashes aren't going to kill you. But the osteoporotic fracture could be an early demise. It could end up being especially a long bone fracture, such as the femur, in which a woman may end up needing to be institutionalized in a nursing facility. And one thing leads to the other. End up the quality of life and developing, it can just dwindle down to so many things that I'm not going to say, because I'm not speaking that on anyone who's in that situation. I would pray that they would get the therapy that they need, the bone would heal, but it's difficult for an osteoporotic bone to heal. So that's why we got to go back and talk about that a little bit more. But But menopause itself is after everything ceases. No more menstrual flow, no more ovary production of estrogen. And that is after 12 months of not having evidence of ovary release of an egg and hormone surges and things such as that. So as I mentioned, we're talking about understanding menopause. I am going to just quickly just give you put this up. I just discussed it with you. I'm not going to read through it again, but just a refresher, right? It's gradual. And what I went to a resource, an older resource, just so that I could, sometimes they don't write books as well as they used to, right? So I went to an older resource that I had, and it actually said that menopause or perimenopause, could be anywhere from 2 to 8 years, but the average woman went through menopause in 4 years. I was like, dang, 8 years, because the new stuff says several years. Didn't come out and put some numbers with it, but back in the day, they actually, actually gave years. And it said the average American woman now lives 1/3 of her life after menopause. Wow, only 1/3. Women do not report depression related to loss of reproductive function. And they do report concern after the symptoms related to menopause. Loss of reproductive function is reported to be a relief to many women. Yep. However, it is the residual that the quality of life. So that's the other reason we're talking about this, because I want you to know what you can do. It's so much easier to prevent something than to go back and fix something. And many times it's hard to repair something once it's lost. Okay? So we were talking about the hot flashes, and I showed you this right here. We talked about just other symptoms, and I went through and told you how the skin, dilates, and how our body tries to eliminate the heat. And we talked about the breast, the pelvis, skin and hair, all of that good stuff. But the thing that I feel led to focus more on was osteoporosis, because of the risk of fractures and what that itself can do to you, and the emotional and cognitive effects. And believe it or not, the emotional and cognitive effects associated with the vagina itself, and the decrease in the sex drive, especially when you are married. And that's the other reason why the topic was broken up into menopause, allowing your wife time to go through this period and go and help support her as she goes through this period. The mood swings and irritability, forgive her, for she knows not what she says. And does she mean it? Because can a woman just 1 minute, and then the next minute she's just as loving as can be? You think about bipolar, right? You think about a person who's bipolar means 2 poles. One pole is happy pole, and the next pole is the sad pole. Well, think about your wife during menopause as being A different type of bipolar. Can't stand you one minute, but love you the next. Bipolar women during menopause, right? Irritable and then loving. Go out their way. The old, yeah, that's the wife I married. Yeah. I don't know who that other woman was that came in the house or came to bed, and just leave her alone. Leave her alone. Wait till the next morning. Leave her alone. Let her get sleep. Many people are irritable when they haven't had sleep. Now, if they have trouble sleeping, they may be irritable. So, support that. Support, because it's not going to last forever. Trouble don't last always, okay? And when it's over and done, like I said, after menopause is a third of a woman's lifespan. So many joyful, beautiful events, occurrences, and all that good stuff after menopause. The sex drive, all of that stuff, right? Okay. Many opportunities. So, but the emotional, the cognitive, we talked about that. And like I said, tonight, I do want to focus on treating menopause symptoms and the risk. And I'm going to put this up for you as I read through a few things. And I'm also got some other slides that I created. So when we talk about the hot flashes, I'm just going to tell you again, because they are significant for many women. They can occur for 30 seconds or for several minutes at intervals lasting for months or years. Okay? They can occur at any time of the day or night, but we did talk about the certain things that precipitated them or could make them worse. And that is an increase in warm weather. So you may have more during the summertime when you're in confined spaces, kind of like feeling claustrophobic in a sense. Your wife may say, open the door. I can't breathe. Woo, I'm hot. Woo. Hand me this. Hand me, give me something to fan with. And that is where people capitalize on those little fans that you clip to your clothes and put batteries in. And then they had the little fan that you could wear around your neck and hang on a string around your neck. And oh my gosh, I tell you, there's so many devices, right? Because when we talk about the side effects of hormone replacement therapy and medications, the risk versus the benefit, right? It may help you make it through your 2 to 8 year period. But if the latter 15 years of your life, or if your lifespan has been shortened because of side effects of the hormones, because we're going to talk about increasing the risk of cancer. Okay. So, but consumption of caffeine, talked about that. Now that may be one of my precipitating factors. Alcohol or spicy foods, right? Also, here's a statement that I didn't make on last week. Women who experience surgical menopause tend to have more hot flashes than women who experience natural menopause. You know why? Because surgical menopause was an abrupt, like, bam, your estrogen is gone. Where natural is a dwindling down, right? So think about it. You're totally gone versus you're fading away. And After menopause, right? Postmenopausal or after that period of time, the prevalence of hot flashes is highest in the first 2 years. For real. So you telling me that after my final period, and my 12 months without a period, there could be a period of 2 years where they may occasionally come back? No one ever told me that. Well, I'm telling you, okay? That's why I said I had to go back to some old resources that just to remind myself. Because like I said, I learned this in school and I passed the test and all that good stuff. But if you don't work in that field every day, you may forget. So let me see, is there anything else? I wanted to say the most frequently reported symptoms of perimenopause, though, is the hot flashes. 70% of women experience hot flashes. And that's usually what takes them to their healthcare provider. The other stuff, they just deal with, right? And the other stuff like below the waist, the vaginal dryness and all of that. Now, what I want to do in regards to that, though, I want to show you, I have a slide here about the urogenital changes that occur. And let me see if I can find what I did with it. Here it is. Okay. Because this is, other than the hot flashes, this is the other main concern and main thing that women talk about. And it's the urogenital. So that is your urinary tract, where you urinate from in your urethra, and the genital area, which is your vagina, suprapubic region, the bladder. These are changes. And so the one of the main changes that a lot of women talk about is the incontinence, the stress incontinence. Like I sneeze and I peed in my pants. Things such as that. That's stress incontinence. There's urge incontinence, where you have the urge to go all the time, okay? And many times when you start having those issues or suprapubic pain or heaviness, many women need to check themselves. What you mean, check yourself? I mean, you could have what's called a prolapsed uterus. So if you look between your legs, and every woman, every man, everybody should have a hand mirror in their house. Everybody. Have your own. It should be a part of your, you got your own toothbrush. Everybody should have a hand mirror, and they're not that expensive, okay? They're really cheap. It costs more money to eat at McDonald's than it does to buy a hand mirror, and then some stuff, okay? So these changes occur because of decrease in estrogen. It causes our tissue to change. It loses its elasticity. So the ligaments and things that hold your vagina in place, and I believe too, if you've had a lot of vaginal births, that increases the potential too. But there are many women who've had 10 kids that they didn't have a prolapsed uterus. So, we can't say that. But the tissues of the vagina, the urethra, the vulva, and that is the area that is around the vagina, and the trigone of the bladder contain large numbers of estrogen receptors. these tissues atrophy. What does atrophy mean? Shrivel up, shrink. When estrogen is reduced, the vulva loses subcutaneous fat. So, where the vulva used to be overweight, it's not anymore. And the epidermis, remember I showed you the layers of the skin. I'm not going to go back and show you that again, but the epidermis and the vaginal epithelium, these are the thin layer of skin. It gets even thinner, okay? The vaginal glycogen level decreases, leading to a less acidic vagina. Let me tell you about acid. If you don't know already, acid kills bacteria. That's the reason why when you get symptoms, early symptoms of a urinary tract infection, like it burns when you pee a little bit, drink something acidic. And I usually tell people, because what is really, really good is cranberry juice. Now, if you're diabetic, they do have cranberry juice with less sugar and cranberry juice that is artificially sweetened that says sugar-free. But it's the acid in the cranberries, okay, that helps. You can also, apple juice is acidic, but cranberry juice, I think, is a little bit more. Remember the pH scale, okay? You can Google something that's acidic. Now, you don't want to drink vinegar, but vinegar is really acidic, okay? If I'm not mistaken, let me make sure I'm saying that right, because I just caught myself and said, wait, you better make sure, because I do know vinegar. Let me see. Vinegar, I really believe it is. I think it's one of the most acidic, and baking soda is the opposite. It's more alkaline. Okay, vinegar acidity, and let me go here, because like I said, I don't want to tell you no story. And how about, don't worry about it, because something's wrong with my phone. But anyway, general lubrication, I do believe it is. But the vagina itself is less acidic, and so you're at increased risk. The environment, susceptibility to infection. So if you've got tissue that's atrophied and all that good stuff, you are set up for a urinary tract infection. And you got distress incontinence too. So, woo! Oh, wow. So, and believe it or not, these are changes that can occur that even when you finally finish menopause, you left with this detrimental whatever situation, potentially detrimental, because you don't have to let it kill you. General lubrication and lubrication accompanying sexual arousal also decreases. So that's the stuff that your body makes. But guess what? There's not too many things that God did not give man wisdom and knowledge is how to create and fix, okay? And there we go. So I wanted you to know about that. And now we're going to talk about, let's go ahead and jump on osteoporosis, and then we'll finish up with hormone replacement therapy and stuff. Before I do that, I pulled up a couple of old slides from the lecture that we did on probiotics, and when we talked about the microbiomes, and I wanted to show you these two. First of all, let's talk about women's daily probiotic, and I'm gonna let you I'm gonna read to you what it says. It is a dietary supplement, and it contains bacterial strains that are healthy for you as a woman or a man. However, it has extra bacterial strains that are good for the vagina. And and I did not, there was another slide that is a long bacillus something, but these are ones that support the health of your vaginal tissue. And it promotes vaginal health. It also supports your immune health and maintains your GI health. Because remember what I told you, your GI tract is where your immunity is. So I just got through telling you you're at increased risk for a urinary tract infection, right? So how well your body fights that increased potential for urinary tract infection has to do with your gut health. Well, if my immune system is good, my gut health is good, and my vaginal health is good, I think I'll be okay. Yeah. All right. So now, here is the veggie biome that I mentioned to you. These are vaginal health suppositories. It's got your prebiotic and your probiotic, right? So, and this has hyaluronic acid and lactic acid. Remember what I said to you about keeping things acidic so the vagina can be healthy and not have odors and things that can happen because bacteria grows. So, number one, let me go back and make this statement in general. Anytime there is a foul odor anywhere in your body, that is a red flag that there could be infection. You smell something, get it checked out immediately. It's just like a stinky trash can. It's all that rotten stuff that's dying and dead that you threw away. It stinks. Okay? So anytime, I ain't trying to be funny, but anytime you sit down and you spread your legs, right, to urinate or whatever, and it don't smell that great, number one, go take a bath. Number two, research and figure out if you take a bath and there's still an odor, okay? Not trying to be whatever, but let's be for real and tell the truth. So there's the veggie biome. Now we can go to our osteoporosis and our bone density. Okay, so I've got 3 slides on that, and then we'll finish up with the hormone replacement stuff. So the reason I put this slide up, because what causes osteoporosis? It is a common side effect of aging. Its severity is a function of risk factors such as gender. So being a woman, not that men don't get osteoporosis, but they do, because they do. But it's more so seen in women. Genetics, family history, and some of that has a lot to do with our normal, some people have small, frail frame and, so Asian, things such as that. Genetics, diet, and lifestyle, because you got to have a good diet where you've got calcium and vitamin D. Remember I told you that. You can't absorb calcium without vitamin D, and some people are vegan and do not do dairy, period, so they have to find alternate sources, okay? And lifestyle, main lifestyle. Do you exercise? And guess what? Weight-bearing exercises can be something as simple as walking. When you walk, your muscles contract, so walking is just good, period. Okay? Physiologically, every time you build bone, when the bone there's weight on the bone. Okay? And so when you take a step, and you're shifting your body weight, one leg, then the next leg, one leg, next leg, that's weight bearing because you're carrying however much weight you weigh, right? So that's weight bearing. But of course, lifting weights and things such as that are good too. But I don't want anyone to think I'm saying go join the gym, this, that, and the other. Listen, if you got to make laps around your house or in your house, if you've got stairs and you choose to lift your body weight up a flight of stairs 10 times a day, so be it. Okay? Those are weight bearing exercises as well and will definitely make a difference for you. Definitely. Especially 30 minutes. I would say 3 to 5 days a week, but there are many, and when I say 3 to 5, because that is what most people may be able to do. But if you can do that 7 days a week, awesome sauce. I mean, the more the merrier, the better, okay? So, but it is at least 3 times a week, a minimum of 3 times a week. And so younger women who experience amenorrhea, lack of menstrual periods, are at a greater risk as well. Because if you don't have a period, we went through that last week about the menstrual flow. If you don't have a period, that means you're not getting estrogen released from your ovaries. Okay, all right, makes sense? All right, there we go. Calcium deficient diet increases your risk as well. And we already mentioned that. Now let's go to bone density changes and bone density testing. All right, so bone tissue density changes continually. And that is because there's a cycle of replenishing old bone with new tissue. From birth through adolescence, the cycle places heavier emphasis on building new tissue, resulting in a net increase in bone mass. So as you reach your 20s and 30s, pretty much that's all the growing you're going to do, right? Most people know you get a certain age and that's probably the height you're going to be the rest of your life, okay? You might shrink a little bit, and that's usually due to bone loss from osteopenia or osteoporosis. You might lose a little bit. Settling of the bone, okay? Like the lumbar region, your back. You hear people talk about, or they get the little hump in the back. Mostly seen in women, but men as well. If their mother had osteoporosis and had a hump in her back, there is increased potential of the man or the woman losing height and bone loss, okay? But by the time you get in your 20s and 30s, that's it. All you're going to do from that point on is maintain the bone density that you have. So that is the reason for the WIC program, Women, Infant, and Children, and making sure that low-income women, because milk is not cheap. You do know that, right? But have the dairy, the yogurt, the cheese, the milk, the cottage cheese, the different forms of dairy, butter, eggs, that's necessary, okay? So, and cereals, because a lot of cereal is fortified with calcium and vitamin D. You can even purchase orange juice now that has calcium and vitamin D. Yep, sure can. All right, so, and so by the time you get 20 and 30, you just have to maintain it. And as you reach menopause, lack of estrogen hinders the building of bone tissue. Men are affected, like I said, to a lesser extent, but do experience net bone tissue loss, especially a man who does not do any weight-bearing exercises, okay? Now, let's do bone density testing because I want to talk about that. So a DEXA scan, bone densitometry testing for osteoporosis. Measurements of bone mineral density at any skeletal site have value for indicating your fracture of risk. BMD is expressed as a relationship to two norms: the expected bone mineral density for the patient's age and sex, and or the norm for a young normal adult. The difference between their score and the norms is reported through these specific techniques. You can have a DEXA scan, which stands for dual energy, X-ray, absorptiometry, or sorptiometry, And I think it's so much easier just to say DEXA. A DEXA can be used to measure BMD in your spine, hip, or wrist. Most of the time, the spine and hip are sufficient, but if they are questionable, they'll do the wrist. So if they don't do your wrist, don't get upset. It may not be necessary. Scanning is completed in a few minutes with radiation exposure 1/10 that of a standard chest x-ray. So it's even no big deal, right? But still, you have to let them know if you could be pregnant, which, anyway, most of the time, a woman is post age of when they have a DEXA scan. But like I said, if you're early menopause, surgically induced, or risk of cancer, or different things, it's not a definite age. You're too young to have a DEXA scan done. Single energy measures BMD in the forearm or finger, and sometimes the heel. So they can instead of dual energy, but most of the time it is dual energy. Also, you can get an X-ray done. So a radiographic RA is a technique used in a standard X-ray of the hand. So you can, let me tell you something. I have had patients that they went to get an X-ray done for one reason, and the X-ray itself showed that there was demineralization of the bone, and that was the first indication that they even had osteopenia or osteoporosis, okay? Some people sneeze and cough and fracture a rib. And they sneeze and cough and they get this pain and they go get an X-ray done. And there you go. You find out that the reason that because most people don't sneeze or cough and fracture a rib. But a person who has demineralization in their bone may. So just a regular chest x-ray because of pleural pain when you take a deep breath, may indicate such. And there's a quantitative computed tomography, which is a CT scan, measures trabecular or cortical bone density at several sites in the body. And this may be used as an alternative to a DEXA scan for vertebral measurements like the spine, your thoracic spine. You have your cervical, your thoracic, your lumbar, and your sacrum, okay? And that is your vertebrae. And we went through this a while back, so it should not be anything that you're not familiar with. You can also have an ultrasound densitometry. Assess bone in the heel, tibia, patella. So you know where your heel is. Your patella is your knee. Your tibia and your fibula or your lower leg, or other sites where bone is relatively superficial. Ultrasound measurements are not as precise, though, as a DEXA or single scans, but accurately predict fracture risk. So the reason I took the time to say all of this is because if you live in a rural area, or you live in another country or somewhere where they don't have DEXA scanning, I need you to know that these other things can help increase your potential for fracture. And understanding the density of your bone can also help you to know your risk for osteopenia, osteoporosis, especially if you are of that age. Okay? That is the reason we went through that, because I have to make sure that all my viewers, not just those who live in cities, large cities where it's no big deal, they have a mobile unit that comes around, or no, there are people who are 20 and 30 miles from a doctor's office, from a grocery store. Okay, so I thank God for letting me know that we do need to start lecturing in that manner. Now, let's go to the hormone replacement therapy that I really, really wanted to talk about. And we're going to start with this here. Okay. Now, this information was taken from an older book that I actually acquired in school. And it is a textbook, which means it is definitely peer-reviewed material, or it would never ever end up in a textbook. Okay, textbook was 2004, so I'm just gonna let you know that's how dated it is. However, good info. I want you to know where we have been and where we are today. And let me also go back and make this statement to you. I am only presenting information to you. This is just the tip for you to go have a conversation with your physician, and also do the research and may get more up-to-date information, such as recommendations. What is recommended today? Yes, I know it's dated material, but it's kind of like the Bible. Everything in that Bible, I don't care, 100 years ago, 200 years ago, 500 years ago, it is still applicable. Yes, it is. We take that information and we add to it. So this information, like I said, is older, but it's kind of like the foundation. Okay, it never changes. So we want to talk about an epidemiological. This was in May of 2002. There was an epidemiologic study published that suggested that estrogen replacement therapy, when used alone for 10 years or more, increases the risk of ovarian cancer. Okay? And since then, yes, there's still a potential and increased risk. It did not change. If anything, this information allowed man to come up with other methods and other things. Okay? Remember what I told you about research, and I told you about clinical research. We're talking about 20, 30 years following a person. And that research itself is forever ongoing. So this study, which came from the Women's Health Initiative clinical trial in 2002, okay, is the foundation, one of the landmarks that help us to know what to do and how to do today. So, when used alone, estrogen now, used alone for 10 years or more, increases the risk of ovarian cancer. The Women Health Initiative study calls into question the long-term use of hormone replacement therapy in healthy women. So remember, if you are having hot flashes because you are deficient in estrogen, you see what I'm saying? And estrogen comes from the ovaries. It makes sense. Yes, it makes sense. Use of estrogen to reduce the incidence of dementia has had disappointing results. So back in the day, they actually thought that the memory changes. They didn't understand dementia and Alzheimer's as they do today. But so, trial and error. Remember what I told you about research. You never know if you didn't try. The benefit of the temporary use of estrogen in controlling disruptive symptoms of menopause is also challenged. So, for the most part, hormone replacement therapy is not like, number one, let's do this, okay? It's not. And the reason, and this is very relevant information even today, the contraindications. Contraindications for hormone replacement therapy are stroke, breast cancer, liver disease, pancreatic disease, a history of thrombophlebitis. What is that? Blood clots in your veins. Yes. Recent myocardial infarction. Definitely not. You had a heart attack. No, you are not getting hormone replacement therapy. Endometrial cancer. Adenocarcinoma is cancer. Estrogen dependent tumors. So, today, we know so much more than we knew back then, right? We know that there is HER2 breast cancer. We know that there are genetic markers for breast cancer that we didn't know back then. So estrogen dependent tumors, tumors who thrive off of estrogen. That is the reason the genetic testing is whether or not you are HER2, BRCA positive, BRCA negative. I'm telling you, thank you, Lord, for the advancements that you have allowed man to know and make. And that is the reason, one of the reasons I chose to gather information from this source so that I could tell you how, or reemphasize how important it is that if you have the opportunity to participate in research, do it. And get out there and do your Google Scholar and look things up, because whatever comes up in Google Scholar more than likely is articles that have been peer reviewed and researched. You will pull up the research studies on certain things. That is why Google Scholar is the way to go when you are really, really digging into stuff to learn. All right. So, and anytime you have undiagnosed vaginal bleeding, you don't know why you're bleeding or whatever, especially if you're postmenopausal. Okay. Like I told you. So now the last thing I do want to read a little bit more is I want you to understand that the hormone replacement, even though, no, I'm not so whatever, I'm not promoting hormone replacement therapy, because I would not want you to take something that has a potential to cause you harm years later. But if your hot flashes are so severe that you cannot function, that is a conversation for you and your doctor to have. Okay. As I mentioned, the forms of administration for hormone replacement therapy, I don't think I already said, but there are pills that you could take. There's the oral form, and there are patches that can be applied to the skin, and then there's cream. And so a lot of women choose to use the cream for the vagina area, okay? So, because like I told you, many of the side effects that long term and the most detrimental to their relationship is the inability, painful sexual intercourse, things such as that, vaginal dryness. So many women do choose to use a little bit, pea-sized amount of cream, vaginal cream, estrogen related. Okay. So remember what I told you about whether or not a woman had a hysterectomy or hasn't had a hysterectomy. So there is the estrogen and progesterone tablets that can be taken, and it's usually 0.625 with 2.5 of progesterone. Because the progesterone is necessary to protect the uterus. It is not necessary to prescribe progesterone following a hysterectomy. So those would be the women who had just estrogen alone. Skin patches are usually applied once or twice a week on a dry, hairless area of the body, but not on the breast. Patches are a lower dose of estrogen than the oral tablet, and 0.05 milligrams is most commonly, and the estrogen is absorbed directly transdermal through the skin. Okay? A woman can wear an estrogen skin patch and take oral progesterone when the uterus is present. So these are options that are available, but there are older options. There are newer medications and newer things out there on the market that I do want you to discuss with your physician or your gynecologist. Okay? Now, here's a little bit more contraindications to estrogen therapy that I didn't go over. A person who has, of course, breast cancer, okay? Family history of breast cancer, first degree relative, no. Cancer of the endometrium, recent thrombosis, which is a blood clot like a DVT, deep vein thrombosis, acute liver damage, and that could be medication induced as well, okay? Seizure disorders, right? Increase of a stroke, migraine headaches, especially if these are some things that your doctor may say, no, because of your high lipids, your cholesterol, your high triglycerides, the fact that, you have bad migraines. You could have a gallbladder that's diseased. The gallbladder can, if there is a blockage in your common bile duct, that can affect your liver levels and cause acute liver failure. Okay. Very complex potential. Okay. So it's not a simple, easy, let's do this, let's do that. Now, I do want to go through the last two things that I want to cover. Let me see which one is this one comes first, okay? These are alternative treatments for estrogen, the need for estrogen, okay? And the reason I want to talk about these is because a lot of people know about them, have heard about them, right? You've heard people talk about herbs and take a little bit of this and take a little bit of that, and decrease your risk of having hot flashes. Okay, and alternative therapy. Let's start with first of all, I do apologize for the noise in the background. You may hear my little robot. I do apologize, but has its own mind, and anyway, so let's talk about exercise, dietary changes, cognitive techniques are all considered alternatives to medical therapy. Understand that. You can increase blood flow to certain areas, certain things you do, making sure you have an adequate diet, okay? Because remember, these side effects are not just the hot flashes. There's a lot of side effects that can be related to these, or can be decreased or diminished based on these. But I do want to talk about black cohosh. We talked about that before. It is an herb native to Eastern North America. Can be used to relieve hot flashes, vaginal dryness, anxiety, and depression. Now, if you want to, please go back to my lecture on God's green earth and go over some of these things. Black cohosh is a source of natural plant estrogen. And back then, I'm not sure if the same recommended dose is 40 milligrams daily. And at that time, the safety profile of black cohosh was positive. It had low toxicity, few to mild side effects, and good tolerability. And if I'm not mistaken, I do remember some of that we talked about back then. Now, phytoestrogens are naturally occurring compounds found in plants that are structurally similar to estradiol. Now, it does mention soy as an example of a plant estrogen. But they have found out that soy had some side effects of increasing. The verdict is not 100% anymore on recommending soy. But soy is an example of a plant estrogen. A daily dose of soy was recommended to reduce menopausal symptoms, but it has not been fully established and ongoing. It was found to be superior, though, to a placebo for treatment of hot flashes when ingested at 60 grams a day. And then there was some suggestions that soy prevented osteoporosis, but we understand how that would work. We know that estrogen reduces your risk of osteoporosis. So if this is a plant estrogen, ding, 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 makes sense to me too. Flax seeds are a source of a substance similar to plant estrogen. Flax seeds can help treat hot flashes and vaginal dryness. 2 tablespoons a day reduces these symptoms. But also know, flax seeds also increases your GI motility as well. Okay? So me personally, I love using something that's going to kill 2 and 3 things at once. Okay? Progesterone can be found in wild yams. A significant improvement in vasomotor symptoms has been seen with natural progesterone. Natural progesterone can be placed in a cream form and applied topically for relief of perimenopausal symptoms. And many times you can go to a compound pharmacy and things such as that are prepared. Evening primrose oil in a double-blind placebo-controlled pilot study did not show any benefit over the placebo in treating hot flashes. So, ginkgo biloba, we talked about that on God's Green Earth, that lecture. Possibly the best researched herb used for therapy, shows a small but significant effect on anxiety and depression, memory, and dementia. And I do remember us having that conversation recently. So A lot of this information, even though, like I said, the book was written in 2004, however, or published in 2004, however, a lot of that information, ongoing research still stands as is today. Aromatherapy, the use of smells, has demonstrated a decrease in anxiety. Okay, so think about it now. If there is anxiety and depression and memory issues associated with menopause, there are many alternative things that can be utilized to assist you. We have technology today that we didn't have back then, right? So today, your phone will remind you. We have devices that we can purchase that will tell us certain things. So thank you, Lord, for giving man wisdom and knowledge regarding things that will help us make it through this menopause. Chiropractic techniques have not demonstrated a role in the treatment of menopausal symptoms. Yoga, though, reduces stress, decreases your heart rate and blood pressure. I've never heard anything bad about yoga. And it improves your physical fitness, and therefore it has been found to be helpful to many patients with menopausal symptoms. Vitamin E can be utilized for hot flashes and breast tenderness. It may also treat vaginal dryness. So a good multivitamin, healthy diet, exercise regimen, probiotics, things such as that, I don't see how all of those things collectively would not be beneficial to your overall health and well-being. Okay? Also know that vitamin E is a powerful antioxidant, and it plays a role in the prevention of atherosclerosis. Woo! So listen. Okay, let me go back to my picture. There we go. I'm back. So, I hope and pray that all of the lectures that we have broadcasted collectively start to make sense. That's the reason why there's such a push toward a healthy lifestyle in general that will take care of everything. So eating healthy, drinking plenty of water, getting adequate sleep. Are you getting it? Huh? Exercise. All of that collectively plays a significant role in how we age. I want to age gracefully. I do. I really do. But I also accept the fact that I'm going to age. And I have aged. And I'm still aging. But aging with wisdom and knowledge and all thy getting understanding, there's nothing better that we can do. Okay? So thank you so much for tuning in with us tonight. Pastor Devil and I will be back on Sunday. All right? So to God be the glory. To God be the glory. I can't go any higher. To God be the glory. He is so good. He's been so good to us. Let's praise him, and let's praise him in advance for those who are in a situation right now that they are barely living and surviving. Let's have our brothers and our sisters back right now. The strong bear the infirmities of the weak. Let's reach a new height in glorifying God. Let's cry out the highest praise of hallelujah to our God on their behalf. All right. God bless each and every one. I love you dearly. And as my dad says, and there's nothing you can do about it. Okay? All right. Adios, amigos. We will see you on Sunday. And I pray that the Lord will give you a restful night's sleep.